Starting.
The minute I log on, I know you can't hear anything I say.
And we're live.
We are live.
Love it.
Okay, we're going to give a few minutes for the webinar to populate. Hello, happy afternoon to everybody. I am Phoebe Stein. I'll be the moderator of today's session on affordable housing. And I'd like to introduce my panel. As you can see, there are 3 out of 4 of us. One will be joining us shortly, is in webinar traffic. I'd like to introduce Faith Marabella, just wave Faith, of Wellesley Design, and our guest for the day. And Stephanie comes to us from Arrow Senior Living, Stephanie Harris, and Kia Weatherspoon from Determined by Design. So thank you all for being with us today. As I said, we are waiting for somebody who is stuck in webinar traffic, and Jane Rohde will join us shortly. For those of you not familiar with the Ageless Living Collaborative, in a nutshell, we are a not-for-profit group co-founded by myself and David Ashen of Dash Design. And our goal is to enhance and improve the outcome for seniors. Anything it takes to make their lives better, we're on it. So, without further ado, affordable housing. It's a really hot topic and it's super important. And there's some confusion around it, starting with the name. So today, our experts are going to try and help us all understand why the name, maybe even help change it, and what it means to be involved in affordable housing. And so to kick off the session, Faith Marabella, what major principles are driving affordable housing design?
So I'm so glad you asked, because the 3 that pop into my head whenever I approach an affordable housing project or community to be is I always look at a great opportunity, of course, to attack isolation. Everybody who knows, who's done an ALC knows that I'm passionate about that. But I'm really excited about the sustainability issues that we're seeing in the built environment and what that means, and longevity and the right materials and et cetera. And then the other one is accessibility. And this is great because you say accessibility, everybody thinks, oh, ADA, and there's a lot more to that. It's about accessibility, to the things in your environment or to your greater community, to resources and things like that. So those are sort of like the 3, that's the triad for me that I really love to talk about.
Kia, I know that you're very passionate about that too. Do you want to jump in and add anything on that? Oh, you're muted.
So this is, at Determined by Design, our focus is about design equity. And in order to do that, we have to start with removing these labels that are mostly socioeconomic driven: affordable housing, low income housing, affordable senior housing. And the minute we start using this language to identify a socioeconomic standard, whether it's a developer, architect, or a general contractor, there's always this automatic assumption that this community deserves less than. So when we don't talk about that we design affordable housing, we create spaces for people, and back to what Faith said, stories based off of the community. That language continues to disenfranchise housing, which results in inequitable design outcomes. And I think we try to dress it up, affordable, workforce, right? When it was really ghetto, Section 8 or whatever, right? It's not the marketing term that we're trying to make it acceptable, is how we create homes and communities for people. I would love to see that language completely disappear.
I'm going to welcome Jane Rohde of JSR Associates. We know you were stuck in webinar traffic, so it's good to see you. Are you ready to jump in? Because I have a question for you.
Sure, why not?
All right. Well, we started off immediately talking about kind of the nomenclature around affordable housing. And Kia brought to the forefront the idea that putting labels on things is not getting it done well. And in fact, it's a negative for all those who are involved in it. It's disenfranchising. So that is a perfect way to bring you in on what are some of the barriers to affordable housing. And again, this affordable housing nomenclature, we got to change it.
Ding, ding, ding on that. Yeah, for sure. Yeah, totally agree with that. So what we see, and thank you for my delay because it was like Zoom world all day. When you really start to look at not just the nomenclature, but the other kinds of barriers, is regulatory can be a huge barrier. But then we also have the other side of access because of reimbursements and issues like that. So one thing I don't know how I kind of found this, but there's the Faircloth Amendment in the public housing language, right? And they're looking to repeal that. And it went into a bill of one of those 15,000 page stacks. And I was kind of excited that somebody thought far enough through that and through the process of getting that repealed, because we believe that that may actually help with the reason part of the crumbling of the system was considered a failed experiment, if you will, which I don't think it was. I think it's just been mishandled like so much. So about probably 20 years ago, maybe not quite that long ago, I had reviewed we have 19 public housing, senior housing buildings in Baltimore City. We reviewed every one of them, and there was some monies to do certain things, but it was a non-integrated process of care services elders and the problem of the barrier that drug abuse and alcoholism was considered a disability. The disability component then said, okay, you are now considered the same stature as an elder. So that left elders in places where they were afraid to come out of their apartments. They would not come into the community space. They would not do various different things. So I think one of the barriers is if we get rid of the amendment, we think not only can we look at the crumbling infrastructure, but in my hopes of hopes, we could actually look at a bigger picture and start talking about community planning, because community planning is what we were missing, because we were talking all about isolation and not mixing incomes and not mixing, not mixing services, and talking about education and healthcare and all the different components. And I proposed a project proposal for a competition, like when I first started my company a gazillion years ago. And Baltimore City called me and they go, Jane, they're just not ready for you yet. I was like, well, don't you have to talk to all the people and look at the precedents? Because we have precedents that work for social community and evaluating that. And man, the guy was like, he was sympathetic, but there was like no way he was even going to bring me to the governmental level to have that conversation, 20 years ago.
Well, I am heartened that you all are leading the charge in this, because each one of you are passionate about it. Each one of you have that same direction about breaking down the barriers and getting rid of, all of the little labels and making this a community of all people. And I love that. Stephanie, welcome. What are the challenges to creating affordable senior housing?
Well, as an operator, we think of it in terms of the building is set, and how do we keep the cost down one way or another to widen the net. And I think there's where we want to be in the industry and the reality of where we're evolving from. And I think the missing component is this middle market housing that is starting to become a more common communication point and a path that operators are pursuing, and many of you probably are working on new developments with that mind, with that goal in mind. I think the biggest challenge that we're facing is that still the largest cost in operating is labor. Second largest cost is actually the physical plant structure and our debt service structure. So really, what you do in your role in design and of the development or the adaptive reuse, whatever the type of project, is the second most significant part that affects our operating costs. And I think that a lot of operators have, it's not just about finding cheap pieces of land, because then your marketing costs may be that much higher. I think it's a balanced approach of collaboration. And I find that in development, often there's an agenda driven by the general contractor. Not a lot of developers play a very active role in ironing out those competing interests and creating the collaboration that may reduce the cost, the redundancy. That's what blows my mind, is how much redundancy this industry has, because subs get involved in contracts and with these projects and don't really understand what one thing is needed in the operation versus what they're used to in another environment, or to get their nut out of the development. And I think that most of creating affordability will be tied to driving down the cost of development, and the focus that you're putting in what you're doing, that we have to be thinking common areas versus rentable space. So there has to be some consideration there. But I think a lot more will be brought into low voltage integration is a definite rising cost. The choices we make in design play a role, but that's pennies in the stack to, I'm getting Kia's
Kia,
support
you've
here.
got to jump right in. We've got to have some
Yeah.
conversation here.
Yeah.
Kia is getting very excited about what you're saying.
So Stephanie, I love what you said from the position of a developer. And we just finished a project here in DC, 100% affordable housing. Ask me how much we had to VE out from a design, finish, decorative lighting standpoint.
How much?
None. And let me tell you why. We forced, and I mean forced, transparency on our general contractor. We found so many dishonest pricing of elements, from lighting to fixtures. And this is the thing. It's kind of like, if you're doing it on this one project, how many
much
times
more?
have you done it on so many others? And those general contractors, those subs, they don't live in these buildings, they don't live in these communities, so they have no skin in the game. And to be fair, our development partners, we understand, like, you can't look at everything a sub sends in your general contractor, but as a design professional, we fought, and I really didn't care. And it's so funny because now they walk the project and they're like, oh my God, this looks so great. I'm like, because you fought me tooth and nail, but thank you. It's transparency. A brick, the cost of the brick is the same, whether it's affordable housing, market rate, or whatever you want to call it. If there is a lack of transparency, the only detriment is with the people in that community. The general contractors have no buy-in, and I hate to have this us and them mindset, but the project ended up having a $2 million surplus. $2 million.
That's amazing, yeah.
But the
You put that back in operations?
I'm sorry, right?
Yeah.
We're gonna not go there yet.
That went to Kia's fee. That's what happened.
I knew it was
She
going to be
earned
a lively conversation, but okay. So we can change it. There are ways to change it. I see everybody nodding their heads, saying yes, yes, yes. Okay, Jane, talk about it.
So change isn't easy. So one thing that we've found, right, is that, and Faith, you know me better than anybody, right? And it's just like, change, please, now.
Yeah.
But when we evaluate it, what I have found is that the development prototype is, if it works good in Baltimore, it's going to work well everywhere else. Well, I've worked for developers like that. I've worked in-house for developers like that. So every time I meet with a new developer or potential partner for our Live Together model, it's like, we're working on a project in Detroit right now. And I love this guy because he has tons of skin in the game, because he owns like the rights of redevelopment for all of Jefferson Chalmers, which is inside the metropolitan area of Detroit. And when I first met him, he did presentation. I heard him in a presentation, then he came and did a presentation for me. And now I said, can we show you our project, show you what we're trying to do? So we're trying to have that engagement center component, right? And working together to be able to create something affordable. Mm-hmm. But the issues in metropolitan Detroit are not the same as our project in Meridian, Mississippi, right? They're not the same. So my approach to development is that we partner with the developer who's in the region, who gets the grassroots issues. Because what he said to me was, you check off the boxes. You check off workforce development, you're checking off the adult daycare center if we can't manage to get extended care. There's something in Michigan called adult foster care homes, and we're looking at taking apartments within our overall community and making those the foster care homes, so that we can add a student, we can have four residents and a staff member, right? Is that component that makes up our home and our apartment unit. So we're still working on some of those ideas. But I have to tell you, when you start looking at the reimbursement, that's another problem, right? So if it's not private pay, completely private pay, there is no assisted living private pay inside the entire metropolitan area of Detroit.
Wow.
Right? So when you start looking at that, it has to be grassroots and consistent, but you have to know your population and what they need and what they want, you know?
Yeah.
Everybody doesn't need and want the same thing. So
And that's what you're talking about, like the boilerplate of zoning and planning gets in the way, because if you want to get the community involved and start with that grassroots part, because that's where you need to break down all those standards, because it doesn't work every place. And so I just wanted to throw that in. Of course,
yeah, and
I
when
know
you
you love code, Jane, so I had to throw that in.
but when you look at the cookie cutter approach, you have to have the right developer who has the mindset that, well, when you prove it out someplace else, come back and talk to me. Because you need the developer who goes, that could work because that would solve these 6 community-based problems. And if that doesn't work, we'll just change this and this when we see if it works or not.
So
There's
Jane,
not a lot of developers in the world that like to play that, you know, so you have to find the right people who are willing to look at change, but look at the grassroots. I'm sorry, Kia, go ahead.
no, do you think that that's only in affordable housing that they try
No,
to do?
it's across the board.
Fair.
Yeah, I'd
Well,
say
because
across
you
the-
raised a really interesting question, Kia, about how do you create agnostic housing that's not strictly age or income focused. And I think that kind of plays into this. And Jane's doing this, so it does.
Mhm.
So let's talk about that.
So I think for me, you know, we think about people, period. Right. For us, the biggest thing is concept development, the storytelling of a community. That's where we start. That dictates every design decision that we make. And I think the way, and I'm speaking from just from the interior design perspective, you know, even the way materials are marketed, this is a senior product, this is a senior material. And then it all starts to look the same. And if we're only looking towards senior marketed things, then we're creating the same communities everywhere. So for me, we don't focus on, and then I think it's also, you think about the senior right now. Not in 20 years, I will technically be a senior. So I'm starting to design, like, what would I want for myself, for my loved one, for my friends. And I think
Thank goodness.
yeah, those are some of the barriers to being agnostic. It's how things are marketed to us, what we should use specific for this project type. And I don't think that, it's kind of back to what Jane said. It's about, where is the project located, that community? Yes, are there certain things you need to take into consideration if it's bariatric, assisted living? Absolutely. But that should not pigeonhole you to the same design aesthetic and outcome that you saw for decades. It has to be more agnostic. And I think this is why removing these labels of housing for this demographic, we create homes for people and communities, period. It doesn't matter where they are on the socioeconomic totem pole or their age. It's still segregation. It's based off of age and income, which trickles down to race, which is why you have predominantly communities of color have spaces that are less than. This is why it needs to be agnostic in my mind. And that was a little bit longer than it needed to be.
No, that's
Yeah,
okay. Well, you know
interesting.
what? We have a question that came in from Kevin, and he wanted to know if there are rules that each senior living community being built today, where they incorporate a percentage for an income-based rent.
Depends.
Stephanie, you're nodding your head.
Depends. Yeah.
Depends on how it's funded. It depends on who's doing the project, where the project is. You know, for me, it's kind of like the percentage thing that makes me crazy. It's like 4% should be accessible. No, 100% should be accessible. So you can live there as long as you want to, as long as you need to, or want to, or whatever. So it kind of depends on the project type and it depends on the parameters. The problem is when you get into the, people say, no, you only have to do this percent. Well, what's your demographic? What's your demographic need and what's the percentage and who should you be designing for and in terms of the people? I think it goes back down to the people.
What's the operator's perspective, Stephanie?
There are no specific, requirements, but we do find that if there is, tax abatement, if there are, certain incentives or workforce programs that might require certain initiatives such as this, but I think we pride ourselves in being kind of, fattest part of the bell curve. I think you have to have an expertise in high income senior housing and low income senior housing. Well, we're somewhere in the middle, and and I think that's the neglected part of the puzzle right now. But we absolutely, and even serving the middle market, have to look at ways to target that borderline senior who would otherwise not be able to afford home care, would self-neglect and choose to live at home or try to suffer with band-aided solutions. We look at how can we segment apartments and for that could meet a broader audience based on price. Typically the trade-off on that is location in the community or size of the apartment. But I think that as operators look at diversifying the type of housing we're offering, I think this is going to be key to have a mix so that if you have high-end services, that's not your standard, that is an upgraded option, just as much as you would have an option for somebody who might think that they would only be looking for low-income housing they could afford because you have that ability to flex. Well, that supplements sometimes the lifestyle offering or diversity within the lifestyle offering that you provide. And I don't think you can achieve the higher level of occupancies above an industry who's in record lows. When we were in the low 90s, is like the good old days, I'll call it. Even then, to break those numbers, you had to look at creative solutions such as providing this wider net. It's cost us incrementally pennies to operate that extra unit at the lower rate to get from a 92% occupancy to try to maintain 100% occupancy. And I think that's the key driver is what you do with your marketing, and keeping your cost of vacancy as low is what allows you then to create that affordability. And I may be a little crazy, but I call it like it's our Robin Hood marketing. So we figure out, but in some ways, as we get to that last little bit of percentage of occupancy, that's where we can create some heck of a opportunity for people who would otherwise think they can't even begin to consider senior living.
Mm-hmm.
Well, you also addressed when we talked earlier, growing resident length of stay and achieving affordability, which I think kind of plays into that also.
Yeah. I think that's really the core of the thought, is that if the industry, wasn't, if you think about all the new developments we underwrite, have a vacancy factor because of the industry's experience. And I think the challenge we have is that senior living is such a sliver of a thought of all seniors who are age and income qualified. Less than 10% even consider this as a top of the mind solution. So even if we just grow market share slightly, communities will fill up or will be able to penetrate that, what feels like a wall of 92%. And I think that gain, so say if you could even dedicate 8% of your occupancy to more affordable solutions, we all come out ahead. I think that's what we need to get other operators thinking and creatively trying to work in their mix. But for us, affordability is key tied into increasing our length of stay and growing that occupancy to get ahead of the 92%. But every resident we save from a better outcome. So either getting them to move in sooner before the crisis, or when they have the scare, and then being able to stay through some changes in care or interventions we can put in place, means we can have a resident living in our community, even if it's 6 months longer. It saves us $7,500 in the long run. Cost of turn, cost of marketing. And that's the thing that we don't talk enough about, is it's these incremental gains of 6-month length of stay or 12-month length of stay that would mean a difference in, a lot of problems operators face today.
Is there research on that too, Stephanie? Because I've been kind of interested in the idea of if I can, so I look at a three-legged stool of a nurse and a PT, OT, and a social worker kind of as my team for my whole building, regardless of level, right? But what I've been trying to see is how much a turnover, an apartment turnover actually costs a community.
Yep.
Because if I can reduce that by 10 turnovers in a year,
Yep.
that more than pays for a good portion of my management team.
Yeah, absolutely. And so I think the industry spends too little time talking about the outcomes in senior living and more about capture rates. And I think what we're going to find is with COVID and the change in length of stay, we're going to see more focus on that research. But internally, we've had to do that ourselves. And like, what does it cost us to turn a unit or market a unit? That's the cost of turnover. And I think that anyone could very quickly see the impact. And that you're right, Jane, it's 1 or 2 saves. I mean, 10 is like hitting the jackpot. But even 1 or 2 could be a significant means of a community being able to, to meet their loan covenants, to being able to be more forgiving when they're reconsidering rent increases year over year, or being more generous to their employees. And like, it's those minor shifts that can cause nice opportunities for communities to have those, to be able to then have those other rewards.
Then it leads to retention, right? So if you get better staff retention because you paid your staff more and because you could because of this, then that staff turnover piece is probably the most expensive, in addition to the unit turnover. So we've been trying to take and assemble those costs and information so that we can identify and demonstrate that out, so that people can understand, where's the money coming from? How are you doing this? Why is this working? And because those are the hidden costs that don't go in a pro forma, right? So it's hard to show where your turnover costs can actually help. And we have found too that the lack of healthcare that's provided to workers is one of the barriers, and that a group out in Arizona that's been doing some work on that, they found that they used it as a marketing piece for hiring long-term care workers. And their percentage of hires went way up, but their retention went way up because no one's offering access to healthcare. So we can, provide both of those. I was like, well, crap, I can probably figure a way out to do that. And then we really puts us in an even better position to be able to serve the community living wage plus healthcare. Yeah. So it kind of looks at the baseline, but anything you ever have on that, please throw that my way. Any revision on that?
Everybody's kind of touched on sustainability a little bit, but Faith, can you speak to some of the issues?
Yeah, I love that you guys really kind of looked at the economic sustainability of a community. I think that's really wise, and we're seeing a lot of creative models about that. Jill Schroeder with Pope Architects, where they were able to take all the different sort of senior communities that are under CCRC and share those commons. And I thought that was brilliant, and I loved it. And we were breaking down, again, those barriers of having a stratification of, of care and of abilities. So I thought that was brilliant. And so that came out of economic need, but it was a wonderful byproduct. I think sustainability, when you talk to an interior designer too, we love to talk about materials, about, we're thinking about materials that are going to last longer, that are going to be lower maintenance. I constantly come into conflict where I still want it to be a warm and wonderful place. And I'm still, Boston has actually put together a whole subsection for senior living under affordable housing, which I'm glad, because we're able to actually work with the local authorities to break down some of the standards that they had. Like they want hard surfaces everywhere. Well, that's terrible for sound. So we can go to them and say, we can do a resilient floor, or can we use carpets in some places? Carpet's not what it used to be, and those sort of things. So I love that, we can talk about materials and still get long lasting products. One of the other things about sustainability that we're seeing in Boston, and I hope it's going to grow other places, but they're really looking at doing passive housing. And a passive house model is, a tight envelope. And of course you have low VOC materials. and very economical mechanical systems. And the idea is so your operation costs on the physical plant, as Stephanie was saying, earlier, physical plant's not just you build the building, it's there. It's a living, breathing organism that you have to take care of over, decades. And we're looking at this as a way that we can keep these buildings healthy and standing, and that's the sustainable part. They're not going to break down unless we want them to. Like, unless it's in the garden, we're doing a composting. So sustainability to me is like, I love that we've got all, you say one word and so much can come out of this discussion. But those are some of the things that really came to my mind when we're talking sustainability.
Anybody else want to weigh in on that?
I will a little bit, just from the performance perspective, because somehow in the energy, we've always looked at performance and sustainability being the same, right? If you perform well. And somewhere in materials, we got into this murky water of the performance versus perception of materials. And I think that that's something that I'm seeing more and more about in terms of product service life, looking at how long products are really going to last. How do you clean and disinfect them? A lot of that's because of COVID, and we were already seeing product failures in healthcare, right? So we're going to start seeing it in other places. So I would post just the thought is that sustainability equals performance and long-lasting products. And we promise not to pick mauve or teal or anything from the 80s if you just hang on to it a little longer and keep it out of the landfill.
Right.
Yeah.
Right.
I think another disconnect here, and Stephanie, I would love to get your thoughts on this. When I have time, right, the next business I'm going to start is a cleaning company. Because what we find a lot of times, James, to your point, it is how these materials are cleaned and maintained that maximize their performance. We give these intensive manuals of cleaning instructions for our projects when we're done. And I've gone to sites and literally seen the harsh chemicals being used, and it's not necessary. Right. So it's, again, having that sub-consultant who's a part of the day-to-day operations, making sure they're adhering to the manufacturer's instructions. That's when you start to see the breakdown in products. And I think it's also, I'm like a one-trick pony here. It's about the people and empathy. If we don't bring in operators and support services who will treat that building like it's for their loved ones, then they will take shortcuts. But the main maintenance piece is key. So give me like 2 years maybe, and I'm gonna have a cleaning company under my belt.
Well, they'll want you in hospitality too, I've got to tell you.
That's fine.
It's the fabrics being cleaned with the wrong solvents, and then all of a sudden they decompose, and I could go on and on. So I think that across the board, the cleaning piece is critical. And we talked about it when we were discussing cleaning for COVID, but really it's cleaning for that sustainability. It's not just COVID. If you clean it, you clean it. And it should last, right?
Absolutely. But like Faith said, like materials, the manufacturing materiality has come a very long way. The technology is so advanced.
Right.
I think housing agencies and authorities who aren't up to date of the advancement of materiality that pigeonholed us to the same thing. I was going to say 90%, 85% of manufacturers have high performing materials with some type of sustainable attribute in the traditional terms of sustainability at this point. If it's not maintained properly, then it's a failure.
Right.
That's where the operation sides come from, Stephanie, with how are we sourcing, not Stephanie, like Stephanie.
Yeah. Sorry, I'm not
to be the operator on this webinar.
No, I want to just add a couple things in there. I think it is all about where you prioritize on, and I think that there is a point where staff become disengaged to certain areas of service to the residents. They think that they're there to provide maybe food, meals, kind of the core services, but don't recognize that it's the pride in some of these other areas, like that we have to get right. I always tell our staff, like if we can't take somebody's trash out the right way or clean their home a certain way, what does it say about the things families can't see or residents can't see that they leaned on us and they're trusting us to do? And it's these obvious things. If there's no pride in the physical plan, if there's no pride in the cleaning process, and maybe the lack of pride is the lack of training. So that plays a role. I think we're learning it differently in our space than because it's such a blend of so many different businesses that we're getting better, and we've learned a lot about infection control even more recently. But I do think that you have to almost be in the mindset every moment with our staff. This is your loved one. This is you wanting to live here. And I'm fortunate that of my working years, I spent half of them living in senior living because I would travel and plant myself in communities. So I had an opportunity to experience what it was like when somebody treated me like I was a task, like they had to come in my apartment at 5 a.m. to do this or that, or they had to clean this, or they would take my towels and clean my towels and not dry them all the way, or stain them, or whatever that may be. And I think that not everybody has had that first hand experience that I think that we've got to figure out how to do better. That this isn't just a hotel where people are going to come and go and we can be forgiven for our mistakes. We're trying to build a culture that people feel and take pride in as a home, because most of the people there, it is their home. And right. I think that there's a bit of a disconnect there, and I think we'll get better over time in terms of majoring in these minor details.
So we look at that from a workforce development perspective, because we've been trying to, so never intended to be an gone architect, gone operator, right? That was never my initial intention in the world, but that's kind of where we are right now. But when we look at that from the perspective of workforce development, we've been talking very seriously about how to get people interested in working in aging, but what is that person-centered care module impact of where you start? Because when communities, even communities that want to change or communities want to do something different, or people are just interested in it, there isn't really a place to go. And so that's a big component of this model that we're trying to work through in terms of demonstration projects, but mostly getting the training institute part up and running so that we can have the person-centered care. This is how you do it. This is why it's important. Because I think that I look at some of our EVS staff and some of the frontline care workers that their hearts are there if they just had the tools or the critical thinking, or they could do their own self-directed work team because they take responsibility. One of my friends, her mother just passed away, and she was in dementia care and assisted living. And she told me, she goes, here's the servers coming out, and it's the personal caretakers or givers that were doing it, came out to try to serve the meals, but what they had was a list, and they're trying to check off the list and find the people. She said it was so disorganized, and I was there to help my mom, but they couldn't give me the meal for my mom because it wasn't checking off the list in a critical manner. And I was like, that's a lack of person-centered care and training and having some critical thinking authority, like being given some responsibility. And I think that with the different people we've been working with to try to get different modules assembled and things like that, I think that is part of it. When I talked to my colleague, Steve Lindsay, a few years ago, when we first started this stuff, we were talking through the Institute part, and he said, people come to us to learn all the time, but we're not set up as an institute to teach. We're an operating community. So how can we do this? And he thought it was a barrier of why we're not at a tipping point to person-centered care. So from his experience, we were able to draw off of what his thoughts and ideas were, and then we've built kind of a team out around that. So I think that I agree with you so much that for the most part, the frontline caregiver, like in my friend's case, she was the one that called and said, your mom has had a severe fall and you do need to come right now. It wasn't the administrator. So that scares me that the management wasn't on top of what was really happening, and it was a frontline care worker who she knew. So we know that the frontline care workers are involved and they know. So how do we get rid of the disconnects? I guess that was a very long-winded explanation of how to get rid of the disconnects.
Well, you're going to have to bring some more to it, Jane, because I want to understand what models are being developed that support affordability for not only housing, but services.
So this is, again, I think that grassroots level. We've been working on a grant with Mississippi State down in Meridian, Mississippi. And the woman was great. She put together the grant and she goes, if we can do this in Meridian, we can do this anywhere. and then we looked at their specific needs and trying to determine how we deliver service. We have one project that we've worked on, and I love it as an example because it's an independent living setting. And she had an assisted living program that was a licensed program. The building wasn't licensed, but the program was licensed. But she couldn't make the numbers work and what her residents needed. So she had a clinical space that was used for assisted living. And what she did was she said, okay, if the program's just not working, let's get rid of it and see what else I can do. So she had a home healthcare company rent that space. So now she has a rental space with a given population for the home healthcare agency. And then he added outpatient rehab to that. Right. So she was like, okay, good. We've got more care service. We know how to orient where we move people within the building. So then she had a dining room space and a public space on the lower level. And she took the kitchen and full blown kitchen, very underutilized, but she needed it for meal planning for the assisted living program. But the senior center in this little town they needed a food service component for their programming. So the deal was, you can use our kitchen, but my residents each get a meal a day. So she just went through this partnership. She constantly thinks about the partnerships, and she doesn't know how remarkable she is, because as I watch her like shuffle things around and trying to make it all work. But to me, that gave me ideas about how to work in our live together model in a more affordable way, right? It's easy to put residential assisted living in a community that's either an apartment or a house or a small house. That's $5,000 a month, or even if I make it affordable, $3,500 a month, right? What I can get out of adult foster care with reimbursement is about $800 to $1,000 a month, right? So you're trying to offset that staff number with the other component of it. So I think that creative thinking of how do you mix those community partnerships and what's available and what's not available, and how do you partner them together? Meridian has overbuilt in the 1970s low-income housing, but they also have a female demographic from the age of 18 to 54 that is ideal for workforce development, healthcare, potential aging positions, all different kinds of things. So there's something wrong there, right? There's some imbalance that's creating a barrier for those folks to be able to either have access to education and then the training and, on down the line. So if we can figure out the grassroots problem and solve that, it could be childcare, it could be care for their elders, it could be almost anything. But if you could solve the community issue, then we can get the services where they need to go. Then we can get the staff hired. I mean, it's ideal. They have an ideal demographic for healthcare workers, which is very unusual, but that's what their grassroots issues are, and how we can partner that together. So that just gives you some ideas about how to, it's not easy. And I think that's why more people don't do it, because it's not a cookie cutter. You gotta piece and part it according to what's in the community and what you need, and then build it from there. Does that make sense? Yeah, okay.
Sounds good to me.
As I rattle away, yeah, okay.
Well, you had a lot of head nodding, so I take that as a good thing, Jane. We have a question. Back to holding contractors accountable and transparent. Kia, how did you hold them to that standard? And can you share more about how you were able to accomplish that?
Oh, it's so easy. In my mind, it's easy, right? We're going to use lighting. Right, lighting is probably one of the most places that lacks transparency between subcontracting. So I don't know where these GC get these numbers from, but a 12th floor, 104 unit multifamily building, the lighting allowance was $100,000. Right, I don't know where that number came from, but that was it. So we specified, for example, this 4-inch square recessed light fixture in the common areas. The GC automatically VEs our entire lighting package. And we're in this meeting and they say, determined by design, specify a $400 a piece, 4-inch square recessed light fixture. I'm like, no, we fucking didn't. Let me text my rep right now. So because our sales reps, they know where we need to be. And I said, Marissa, why would you let me spec this? She said, Marissa sends me the quote she sent to the subcontractor. Our light fixture would have been $175. Now, even with the VE alternative, the contractor was trying to put in there with a 60% markup, our fixture still would have been cheaper.
Wow.
No, and I'm thinking like, wait. If you're doing this with 64-inch square recessed light fixtures, you're doing it on everything else. So Kevin, what do? We say, well, if you can't get that pricing, we'll purchase it. So we end up purchasing all the decorative lighting, general lighting for all the entire project. Not only did we get it under the $100,000 allowance, we also had $16,000 extra dollars. But when the GC was purchased, his sub just couldn't get there. So when I say it's really kind of simple, you just have to see proof. And I know my development partner isn't going to be able to do that. That's my job as a designer. So we have a custom $20,000 backlit LED panel system in affordable housing because we force the transparency. And if you can't procure it at that price, then I will. And a lot of times it's about this markup culture in our industry. And the markup is really to make the elevated design inaccessible. So if you won't give the fair price, then I'll purchase it and my clients get my price. Who says I have to mark up? Who? Why? Industry? Because design is this elite thing? No, fuck that. It should be accessible to everyone else. And if you won't force their hand, then I do. So it's very simple. In my mind, you just have to care.
I've done the same thing.
Answer your question, Kevin?
And
Kevin-
lighting is the.
Kevin said, thanks so much.
Yeah, we've done that too, where they'll say, we're gonna do this, and I go, well, the owner decided to purchase that directly, so you don't get that anymore. Yeah, when you start pulling stuff out of the GC where they think they're getting their markup or whatever, and for me, there's always that contractor who says, she specified this and it's way too expensive, and then you find out from your rep later that they never even priced the product that you specified. Ooh. You know, that's one of mine too. So in working in-house, didn't make any difference whether I worked in-house when I was working at Ericsson or I'm on a project as an individual and outsider. But we've done that in a lot of cases where we've tumbled up their world, and I think Kia, you probably tumble up their world every single day.
It's kind of like fun at this because I think the optics of it is what pissed them off. You have a young Black girl, perceived younger, it's oftentimes 10 years younger than what I really am, forcing these big white contractor firms to be transparent. Yeah, you know why? Because the people in this building, they don't look like you, they look like me. And they deserve the exact same thing that you want for your family. So I'm not approaching it from a place of, I want to get you. I'm approaching it from a place of they deserve equally elevated spaces, period.
Well, fairness and
Yeah, I have to say, I am so glad you do that because it's one of the things. I actually had an owner where we had put together and it was an affordable and it very much fit this historic building which we were moving the community into. And the things we're doing, they said, we can't have it look too nice. They can't have nice things. And we parted ways after the project because I just got so tired of that attitude. And I'm sad that it's, in for the people who are providing the care so I'm so glad there's others out there, fighting that fight with me. So thank you.
sounds like there's a strong sisterhood fighting the fight. Let's go back to middle market and affordable providers offering no to low service senior living as the alternative to typical senior living. Stephanie.
Yeah, I probably just a couple quick comments on that. I think one of the most insulting thing is new entrants into senior housing thinking they can just strip out services and call it affordable senior living, and that just doesn't work. We still have an aging problem, and the cost of shifting that care into then skilled nursing care would be even more outrageous. And I think that we have to commit to full services, but I do think that it's aging in place that makes the difference. It's communities that offer, in some states, it has to be separated from independent living from assisted living, but where you can gain the earlier move in and the length of stay that I was talking about earlier, I think is really the winning combination to create affordability, because there's less disruption costs to the operation, but you typically have a far better outcome with the resident based upon them moving in at a more well-designed space for aging than what they might be achieving in their single-family home. And that alone, I think, when you mix with independent living to the aging services, you can, with scale and the right mix of units, achieve full services in a campus setting like that.
And I have something to add to that too, that because I've kind of been working through this, that even all those years ago when I worked on public housing and we're trying to get service and things like that, what I realized is that if we took their management of, say, the property manager, assistant property manager, and the different people, and you replaced the assistant property manager with an LPN or an RN, you could start to deliver this idea of coordinated care. Because I think that sometimes even that step of having the right people at the table and looking at it differently, I so tired of the conversation of we do housing, we don't do services. I'm like, it's stupid. So it's like, it's all integrated together. Any opportunity to co-locate, right? So that's always something. I remember working with one developer, and we were working on PACE projects, which are the Program for All-Inclusive Care of the Elderly in the adult daycare world. And their department was completely separate from their senior housing world. And I go, what do you use that space for? He goes, well, it's kind of like the medical space, but they didn't partner with anyone, so it never got developed into anything. And I was like, why aren't you co-locating your PACE programs with your senior living housing so that the percentage that needs it can age in place, you get less turnover, they get service, you get a good rental property, rental tenant. It just had so much opportunity. And then eventually they closed down the PACE component altogether. But I was just like, how hard is that? Like, to just co-locate where things are needed. So the exciting part about multifamily right now for me is that whole tenant retail space on the bottom, they don't really know what to do yet. And they're looking. So I've had some really good conversations with people since COVID started about that whole multifamily and the opportunities that we could do to have service and coordinated care and just, all these different components that could happen for everybody in the building. And so I never would have had those conversations if we were still in the boom of where we were before COVID, right? So this is going to give us new developers who might be a little more, it's not really senior living. We're calling it intergenerational living, and it's just living. It's a community and it's living. And then if you add in these various components, it could help a single mom with a child who's sick for the day, as well as a senior who needs transportation to go to the doctor. So why is any of that different? Because the services are basically the same from a coordination perspective. And so I think that there's opportunity now that we've never had before that I'm so super excited about, because we can make some really good changes, and we're looking for those partners that want to talk about that, so I think we're in a cool time in a way, and then we're in we got to figure out the long-term care skilled nursing side.
Jane, can I get your thoughts on this? I try to remove the word services, right? Because you often hear that, poor people need services, the affluent need amenities.
It's what you do to a car. You service a car, not a person.
And the thing you just described about a mom wanting access to a grocery store or to go to their doctors, is that services? Or is that just people want to live? They want easy
coordination, help. It's help. It's just getting the assistance.
Right? I think the poor people need services and they need amenities. No, we all need amenities or things in life that should be easily accessible.
We need access.
And that was what I was saying earlier. Accessibility is not just ADA. Accessibility is having resources around you, not being on a food island. All of those things. Having the intergenerational, so you can share responsibilities with one another, check up on one another, and so that you don't have to have a designated servicer. It's that building of the community, and building that community that's co-authored by more than just one generation.
Back in the day, it takes a village. It's community. And I think if we strip it back down to the basics and
Mhm.
stop trying to convolute it again based off of age and income, and they need services, and they like, no, we all need community. And for me, the language piece is always a big part of what we do, is checking language, because the language, that's how you start to weave in biases that exist against a specific housing demographic.
Mhm.
Yeah, I think that if you
So,
look at the universal design definition from the University of Buffalo, that gives you, it's a process, right? It's a process to have access, so you don't have isolation, you have socialization, you get access, right? Back to face word. So it's access to what you need.
Mhm.
But,
So
that's-
I'm gonna start wrapping us up because
What? We're done?
I know, I know. I wish we had done this for an hour and a half, but we can do an affordable housing part 2. And then maybe we can wrap our arms around this nomenclature and change that terminology, which I think based on everything that's being said, it's more clear to me than ever before, that name has to go. So Kia, how do you think design and planning for seniors 20 years from now will look? You're muted.
I'm gonna be really hopeful here. You ready?
Uh-huh.
I think in 20 years, housing will be fully integrated and inclusive. You will see no more segregated housing based off of age and income. It'll be community with access to things that all people need.
Thank you. Faith.
I could just say ditto. That's where we're headed. And healthy environments, built environments, living, breathing organisms and buildings that are there to support those communities.
Stephanie, what do you think? And how's technology going to play a role in that?
Well, I think it's going to have to be the solution to the affordability challenges, and some of the costs we talked about earlier in the call. I think it's going to be the driver to enable people to live more independently or in a more congregate setting in a more affordable. It's just going to have to be at the core of any solution.
Jane, last words?
Inclusivity is the word, girl. Yeah. Yeah. So every time we look at inclusive design, and we don't have inclusive design in healthcare, for example, in hospitals and outpatient. And the 2022 guidelines are coming out, and you should have saw the hospital and outpatient folks are like, here she comes again. but this time they embraced it. And we have a new board member who has a gerontology background in bioethics that's on the FGI board. And I'm very excited about what she said about inclusivity, because she totally got it. And I thought, all right, we've got advocates. We've got advocates for inclusivity. And I think that I agree with everyone else in what they said, but it's where we need to go, where we need to be.
I think this has been an exciting hour, and I hope everybody who's been with us today feels likewise. If you would like to hear more from these panelists and you'd like to see another session extending the conversation on affordable housing, please let us know. You can always go to our website with comments, agelesslivingcollaborative.org. I'd like to thank Faith, Stephanie, Kia, and Jane for joining us today. And I look forward to seeing you all soon.
Thanks.
Thank you.
Thanks. Bye.
Bye.
Bye.